In medtech, the difference between a good quarter and a great one isn't always the product. It's the friction standing in the way. Broken sales cycles, misaligned teams, deals that stall at the finish line. Every leader feels it, and the best ones know how to remove it. Welcome to Zero Friction, the podcast where we go inside the minds of medtech's top commercial leaders to uncover the real barriers they face, the decisions they make, and the systems they build to keep the revenue moving. I'm your host, Terry Kuchaluchis. Let's remove some friction. Well, welcome, folks, to the Zero Friction podcast. I have a really exciting guest today, Dr. Jason Jones, who is a board-certified orthopedic surgeon. He's been doing knees and shoulders for more than 13 years right now, and he is heading up a practice in Nashville, Tennessee, and we're excited to have him. So, Jason, if you could just give us a little background on yourself as a specialist, as well as some background on your practice.
Well, thanks for having me, Terry. I am an orthopedic surgeon by training. Well, what that means is I did my 4 years of medical school, and then I matched into an orthopedic residency. I did my orthopedic residency on Long Island in New York. I spent 5 years learning the basics of orthopedics at that point. That's everything from foot and ankle to neck surgery to trauma, which was really actually high volume in Long Island, unfortunately. And then after finishing my residency, I went to the city. I was there for about 2 years. There, I specialized first with sports medicine. So I spent a lot of time working with teams all the way from high school teams to the professional level. I spent a little bit more than 2 years doing that. And then I did my last fellowship, which is kind of a focused learning on a certain body part or a certain specialty or a certain technique. And that last portion was done in Nice, France, where I just studied shoulder surgery. And that was about a 4-month process. Following that, I immediately turned around and went back close to home to Nashville, Tennessee. It's where my wife's from. And it was, I grew up in small town Tennessee, but it was always kind of written, in the stars that we'd be in Nashville. I knew that from the day that I met my wife. And we went back to Nashville, Tennessee, and we've been there ever since. I quickly, after going back, I joined a small private practice. And by small, I really do mean small. It was me and one other physician. And we've grown from a patient volume quite a bit since then. But from a provider standpoint, we haven't grown overly abundantly in those 13 years.
That's great. Well, Nashville's a huge healthcare town. I think one of the largest hospital corporations in America is based out of Nashville with HCA. It's a great healthcare town. And so tell me a little bit about the practice and like how your practice has evolved over the last 10 to 15 years with healthcare changes and patients and all that type of thing.
Medicine's evolving quickly in a lot of different ways. So I can't, just sum it up with one specific example, but the practice has evolved from a services offered standpoint, from a patient expectation standpoint, and the way medicine's delivered. All that's changed significantly over the last 13 years. What's also changed is the economics of medicine, which are constantly evolving, really at kind of at warp speed right now.
It's crazy, and I hear that quite a bit from all kinds of healthcare practices that, the volume is getting massive. The expectations of the patients are changing. The economics in healthcare, are probably really challenging in terms of trying to run a practice with higher volumes with the capacity to meet patient expectations around experiences. What are you finding that are the biggest challenges, or what are the biggest sort of hurdles for you as a practice today? And what are some of the things that you're trying to modify and transform around?
So our number one goal, our number one obstacle that we're trying to overcome is just providing the best patient care possible. And that has been true from day one. That'll be true until the day I retire. And that's just something we always keep in focus within the practice, because if we're not doing the best job we can do, then we're doing something wrong and we need to be better. Now, what that means is changing. It's changed over the last 2 years, over the last 5 years, over the last 10 years. The biggest problem we have with patient delivering the best quality and service to the patient is accessibility right now. The patient volume, you kind of referenced this a second ago, is as high as it's ever been.
Yep.
We have more patients than we've ever had, for better or for worse. The model actually encourages more patient visits, so that the current reimbursement model in medicine, you're rewarded for the more patients that you see. From a provider standpoint, I only have a set amount of time during the day. So if I have 40 units of time to give, but I'm being asked to see 50 patients. There's a number crunch there. And
Right.
trying to figure out how to make that work has been like a tricky aspect of medicine, especially in the private sector. Some of the hospital-based physicians are able to overcome that because there is a built-in safety net by the hospital for either collections, for reimbursement. They have a large, extremely large staff and a big business arm behind them. There's a big access to ancillary, and potentially they're rewarded for introducing patients into their ancillary service. But for a small private practice, providing access for a growing number of patients has been a challenge.
Yeah. I know like probably 10 years ago, there was a big move in healthcare where hospitals were purchasing private practice groups. And
Mm.
I know that when you and I discussed earlier that, there's kind of a shift back to, going back into the private practice arena, but like, how do you accommodate, like, are you using new technology? Are you phasing in different levels of service in terms of like a mid-level nurse practitioner or PAs, or how are you accommodating the higher volumes of your patients? Because care is number one. And I love that you say that because the quality of care is what we're all here about, whether you're on the giving end or the receiving end. And I'm just curious how you and your practice are sort of evolving to maintain that level of care, even though there's friction or inertia coming from you in multiple angles.
Well, the two things you just mentioned are two resources we've utilized already, being mid-levels, which is the oldest solution for this problem. Mid-levels being physician assistants and nurse practitioners. I've been blessed to have excellent mid-levels my entire career. I currently have two fantastic mid-levels that really do streamline the process for me. And what we are able to utilize them to do is to see kind of standardized patient visits that they're trained to do and that they can do without my direct oversight. And that encompasses maybe 40% of our patient visits. They're either long-term follow-up visits, sometimes just a post-surgical consultation. So patients that have already undergone their primary treatment. And it's just more of they're still in that follow-up window. And that works. It's not always ideal, but for the given parameters around having a private practice in this medical economy, that is a solution that a lot of practices incorporate. There is some oversight needed. You have to make sure that your mid levels are well trained, that they understand sometimes some more of the nuances of your specific specialty because they have to be aware at all times that nothing's being missed. But as long as the mid levels are well trained, they're good with people, like that model helps. And it's almost necessary in a lot of specialties, especially surgical specialties. The other thing you mentioned was technology. That's a more recent implementation for us, but we've incorporated ambient dictation,
Mm.
which has saved me 45 minutes to an hour a day. It's saved my entire
Wow.
team the same amount of time. So over the course of a week, I think, me and my two primary mid levels, we've gotten probably 6 hours back, which is
That's great.
unbelievably valuable. The electronic medical records, which is that's been kind of a standard in medical practices for a while. We've just recently kind of incorporated that into our billing system, into our note-taking system. So the accessibility for the other parties that we have to work with being, billing, insurance carriers, sometimes third parties that, patients need to transfer medical records to, all that has become much more streamlined as well, which has also probably saved us, an hour to 2 hours a week.
Well, good. I mean, you're able to clip an hour here and a clip an hour there.
hmm
So has AI entered your practice yet in terms of, low impact? Maybe it's just informing, educating, things that are easy questions to answer. Is AI played a role yet, or are you just looking for the future on how AI can enter into your practice from a healthcare perspective?
Well, both. AI is very prominent in healthcare now on both sides, and by I'm splitting sides by saying that, but on the insurance reimbursement side, AI has very much already been implemented to review provider notes, to check for insurance validity, to follow up on surgical necessity, things like that. They now kind of scan these provider notes to make quick judgments on that. And then from our standpoint, we standardize a lot of the things that we are able to do. Most importantly, what I mentioned earlier was ambient dictation,
Yep.
which essentially is that there's a recording in process. So the entire interaction between myself and the patient is recorded. And then that's distilled down into a medical note, which is the most useful product of AI that I've experienced yet as a healthcare provider. I also
Right.
use AI to do some quick just data search for a lot of times that's like codes because there's a lot of medical coding that insurance companies require. I mean, there's tens of thousands of codes, and it's impossible for any provider to know even 50% of the codes that they use on a routine basis. So quick code searches with AI is very helpful.
It's crazy because the whole medical reimbursements, I mean, there are specialists that, it's created a whole occupation for medical reimbursement
Hmm.
specialties, right? Because it's so complicated and our government makes it so easy for us to get paid for the things we do sometimes. So, um,
Hmm.
the patient's changing. I'm sure your patients are more informed than ever too. Not just with the internet. Now you have AI telling patients about, what's going on and how they should be treated and what their options are. Does that change anything from like when you're engaging with patients in terms of the conversations you have today versus maybe a year or two ago?
It does. A lot of times we have patients come in that are looking for something specific as opposed to looking for answers. And that's
Right.
not universally the case by any means, but it's much more common now where a patient comes in and tells me, I've had shoulder pain for 3 months. I've tried physical therapy. I've taken anti inflammatories. AI now tells me I need an MRI. Can you order an
Right.
MRI for me?
Right.
It doesn't always kind of play out that simply, but that is a thing where patients come in and they have a very specific request. That is different. That's much more common now. The other thing I see with AI is patients tend to go down a rabbit hole, and
Mm.
it's the Google Doctor syndrome. It's that
Sure.
they have a symptom, and a symptom can represent 25 different pathologies, and sometimes there's a fixation on the wrong pathology. And that's just where you need a provider with experience and the medical knowledge to distill what really is a risk and what's not. But so the Google Doctor syndrome's certainly magnified now that AI is so
Now you have
accessible.
AI doctors, right? Instead of Google doctors.
Abs- Absolutely, yeah.
So there'll probably be a new stream of patients coming into healthcare now, which, probably play when you're on the other side of it and you're the doctor, that's certainly it can bring challenges at times too, I'm sure.
It can, and I think for what I do in orthopedics, they're generally patients that they have trouble with activity, they have joint pain, there's something that they want to do and they can't do anymore. So for a patient to seek out an orthopedic isn't always a stretch. That I don't think there's a whole lot of fear in the system right now about orthopedics,
Right.
but, but because a patient's limited, the patient knows that they're limited. They can feel it. Their knee hurts, their shoulder hurts. So for them to seek out an orthopedic provider isn't typically a big reach despite their feeling on the medical system. There is this kind of growing distrust within the medical system that maybe you are or aren't aware of, but there is a concern, especially about some medical providers, that they can be misleading. That they treat diseases, they don't prevent diseases. That's kind of a little bit of a mantra right now in certain communities.
Yeah.
So I think that's challenging for a sector of physicians.
Well, and I think healthcare is all moving in that direction. And so what I'd love to hear more about is like, so you have the practice today and where do you see your practice going, in the futures? As all these changes are coming, preventative healthcare, home healthcare, people wanting different levels of care when they want it, where they want it. What are you in your practice doing to sort of accommodate like this new consumer of healthcare?
Yeah. So when you say consumer healthcare, that encompasses this kind of growing sector of healthcare that I think a lot of times gets called the wellness sector. It's growing
Yep.
quickly. It's not necessarily led by medical practitioners in a lot of
No.
cases. I would actually, I'm completely guessing here, but I would say less than three fourths of those businesses are not led by medical providers. So maybe a quarter of them actually are medically directed. And that is introducing a treatment regimen that patients research on their own. They hear about it through different resources. They're curious. They believe in it. And all this is important. And then they seek it out on their own and they can freely purchase these services, these, the modalities, the medications completely on their own. So at that point, these businesses, these wellness centers, they're just supplying a product. And there's a role for that. There's absolutely a role for that. It's a growing part of medicine. And currently there's not and I'm lumping this all together. I mean, the wellness sector encompasses everything from like IV therapy, which actually is very effective and has tons of, data supporting this for, you know, decades. And then there's the peptide sector, which is kind of new and at this time unresearched. And
Yeah.
when to say peptides is very confusing because insulin's a peptide. Insulin's saved millions, tens of millions of lives. Like that we can't really drop insulin into this peptide market. But
Right.
there's the newer peptides that have been really publicized recently, and there's a lot of excitement about them. But there's not much research around them. My general idea is that they're safe and they can be effective for certain patients. But I think what's interesting is that patients are researching these, coming up with their own conclusions on them, and then seeking them out on their own without any kind of prescription or necessarily a medical recommendation to use these. And that's new in healthcare. I can't think of any other specific like medication. 'Cause these are typically injectables. So this isn't typically a cream you're rubbing on your joint. I mean, these are things you're actually putting, more substantially in your body. And I can't think of another example where just the consumer market has sought out a medication or any kind of treatment to that degree.
It's kind of crazy. And, we had the Google doctor and then we had the AI doctor. And now you think about peptides and I think about the Facebook doctor now, right? So,
Yeah.
who aren't really doctors, by the way, but, it is exploding. And I think the peptide market, I think Eli Lilly sold $36 billion last year in GLPs. And I think that the entire peptide market is getting close to $100 billion a year in the US, just to throw out some macroeconomic factors. So you're right. It's increasingly becoming more accessible and acceptable. But at the same time, I think that, how does an orthopedic practice sort of embrace that energy and that acceptance, right? And that ability to engage patients with a peptide. Maybe, I'm sure there are peptides. There's a peptide just about for anything. I'm sure there are peptides for joint pain or, you know, things like that. How do you embrace that in your practice? Do you think one day, does that become a part of your practice? Is that off to the side of your practice? Or not a part of your practice at all?
We are making it part of our practice
That's exciting.
cautiously. I'm sorry, what'd you say?
That's exciting. That's great.
Yeah, I think it's necessary to kind of accept the evolution of medicine. And I've done my own research on peptides, and I typically don't recommend things that I haven't tried myself. So most of the common mainstream peptides I've tried myself as well. In general, like peptides are safe, which is incredibly important. Peptides taken in the correct amounts are a safe treatment. Now, how effective they are can change from one person to another. And the placebo effect is incredibly real. Not that that's a bad thing. If the patient, I think, believes in their treatment regimen and they feel better, then we've accomplished what we're trying to accomplish. I think of really paramount here, though, is just following the scientific method, being we have to track what these medications are doing, how they affect patients over time. And we have to be prepared to adjust if there are issues with these medications. There's still a lot of data coming out about GLP-1s. And
Yep.
in general, GLP-1s are safe. They're unbelievably effective, but there are some things that we still don't really understand. People's heart rate variability decreases when they're on GLP-1s. And what does that mean? It's hard to say exactly what it means, but it does in some way suggest that their bodies are not adapting to normal recovery the way they were prior to the GLP-1s. There's concerns with bone mineralization with GLP-1s, but none of this has necessarily been shown in structured research at this point. So it's really a matter of the medical world, like the physicians, the providers, the research scientists tracking these and really putting a lot of time into seeing, are there concerns with how these affect patients over time? And I think that's our role as like the scientific community, to try to identify any concerns or potential problems with these medications.
I think that's great too, that, you think about the gray market in the peptide arena, right? Again, you have companies like Hims and Hers and Roe and all these sort of online pharmaceutical companies that have physician prescriptors and things like that
Hmm.
they don't really engage you. You fill out a form online and you send it in, and then they send you drugs, right? And with
Hmm.
some needles. And so, as I think about it, like if you're a patient wanting to go take a peptide of any kind, why wouldn't you go to the doctor that you're currently going to anyhow? So I think
Hmm.
you pivoting to this is really not two things. One is it's great for your patients. Number one, that they have a clinician who they can trust that is, scientifically and board certified in a specialty and they practice medicine. What a better way to get a prescription for a peptide than to buy it off of Facebook or another market.
Hmm.
So I
Hmm.
think that's a great pivot there. And it's probably a really good thing for you from a business perspective too. And running a practice, it's probably, a great way to keep your patients engaged over a longer period of time as well. I would imagine you can give better experiences.
Hmm. I think a lot of patients are looking for these medications. And as long as I feel like it's an appropriate treatment regimen, it's probably in everybody's best interest for us to distribute it. And I'm saying that blanketly to like a whole wellness sector. And obviously, we have to pick and choose what peptides, what medications, what supplements we should give to patients that can help provide the best outcome. And I think our role is to provide direction.
It's awesome too. I mean, because and from an orthopedic perspective, I'm sure there's probably a group of peptides there too, right? Because they're not all subcutaneous. Some of them are oral, some of them are nasal. I mean, there's all sorts of different ways to ingest the peptide. Correct? I'm wrong?
That no, you're absolutely correct. Subcutaneously is kind of the most effective way. So, the small shot, typically in the abdomen, is
Right.
for almost every peptide. There, I can
Okay.
think of one or two that's not the preferred method, but for the other 120 kind of marketed peptides right now, that's the best way to take the medication.
So we have the peptide market, we have wellness. Another emerging space, I think, in healthcare is the concierge medicine part too. And is that something that you're considering for your practice as well?
It is. The idea behind concierge, from our perspective, is access, time, and availability. And we started this conversation discussing what the difficulties are in medicine right now. And the squeeze is that I need to see more patients. I need to provide more access when I don't have the time and the staff to do it to the depth that I would like to, especially in the medical world where things are confusing. I think a lot of patients don't understand the details of medicine, of orthopedics, of the treatments recommended, even after we've had the discussion. This is an entirely new concept to the majority of patients. So, in order to provide that extra time, the concierge space gives us a window to give patients more accessibility to have conversations after their appointment, clarifying confusion that they may have, asking for answers to questions that they didn't think of until they were in their car on the way home, and also giving more time to patients during the consultation.
And your your time problem, I don't think is going to change. It's not going to get better either, just with the aging demographics as well between
Hmm.
the baby boomers and the Gen Xers, at least in your practice of time frame, right? The math behind it is not going to support less. You're only going to have to serve more. And so that concierge space is probably how do you go, how do you go reach that customer? Have you thought about like how you're going to go try to connect with that customer and who that not customer, but who that patient would be, that client from a concierge perspective might be?
I've thought about it. We are close to kind of unrolling this program.
Oh,
We,
good.
but we currently have a large patient base.
Right.
So our goal here is to provide more access and time to the patients that choose it without isolating the patients that don't choose to follow this path. So that as far as like marketing, getting the word out there, it's different with orthopedics because most concierge models they follow the medical model where patients have 3 to 6 month follow-ups routinely. They'll be seen by their primary medical doctor 3 to 4 times a year. And if they have any kind of acute illness, then that's also kind of built in and offered during that same window. With orthopedics, more often than not, a patient has an acute event. We treat that event, they get better, and they no longer require our services.
Uh,
So when we offer the concierge model, I think one of the big questions is, what patient are we actually kind of going after?
Mm.
And orthopedics does encompass something beyond the ACL injury, beyond the rotator cuff injury, beyond those acute injuries. I think there's the patients with chronic joint pain.
Mm.
There's also the families. There's the families with young kids who are active in sports where, injuries are unfortunately kind of part of that, of their normal, activity, like with their normal lives.
Right.
So I think that a lot of times those are the patients that we're kind of looking at for the long-term concierge model. And as far as reaching them, we plan on doing it through our current patient base, just maybe starting an email marketing campaign. There's going to be information around our office, and then we'll do kind of a small marketing campaign within Nashville as well, just to reach out to our current physician providers, to our current, large kind of patient focused sets, whether that be in the gyms, whether that, be in like some of the larger workplaces, and just kind of let them know that we're here, we're doing this. If it's something you'd like to look into, contact us here. And then the last portion of this is kind of within the surgical realm. So when we start offering surgeries, especially joint replacement, something that's very standardized, something that has a 8-month window from consultation to kind of pre-treatment to the surgery to the post-treatment, we want to package that as also kind of a concierge plan. So instead of signing up for a multi-year or like a membership model, we would just say, over the 6 to 9 months, you have access to, these preferred modalities, to these preferred treatment algorithms, to these, if you want access to peptides, we can provide that. And we're going to optimize you on the front end prior to the surgery. We'll execute the surgery. And then after the surgery, you will have that same access, and you're going to follow a protocol that we kind of really invest in and work with you on more of a day-to-day basis, as opposed to the current medical model where we might see a patient every, 2 weeks after some kind of procedure.
Or 6 or 8 weeks, or my mom just had a couple hip replacements last year, and so
Yeah.
I do understand that kind of process and routine. And any thoughts of like engaging in an app or anything like that as well? Just for
Yeah.
you know education, information, SMS engagement, notification engagement. That's sounds like a very cool thing to do, and it's smart because I think as one of the frustrating things as a patient is like, it might take you 6 to 9 months to get an appointment with a specialist.
Hmm.
And I can just, not orthopedic wise, but I know that in Florida, like to get a new neurologist, it'll take you 6 to 9 months to get a new appointment with that specialty.
Hmm.
So, I think that you're providing access to care, you're providing, more knowledge, more information. And, if that all happens, the goal is to have a better outcome. Probably everybody's very happy with that.
Yes. Yeah, that's always the goal. The best outcomes, the best patient experience. And these are all we have to keep in mind during very difficult times in these patients' lives. I mean, nobody wants to go to the doctor's office. I mean, I
No.
think that's universally true. Nobody wants to go to a doctor's office. And so our goal here is that if you need to go to the physician's office, if you need to go see an orthopedist, let's make it as smooth, understandable, and accessible as we possibly can.
Get them in and get them out and get them healthy again, right?
I do love the idea of the app, though, and that's something that we've thought about, but I don't really know what pathway to go to explore that.
There's a couple different pathways. I know app, if you're not going to go like market and try and sell it on the Apple, the podcast, or the App Store, I think there are different versions. But, I just know for in general purposes, if you have an app that you're engaging with, and that concierge service is a nice way to, it's a different way to schedule, it's a different way to get informed. You might even have patient information that they can have access to along the way. It's
Hmm.
just, in today's digital environment, people want to kind of have that info at their fingertips, and it's a pretty reasonable way to do it. And it's just another part of the overall experience that you're trying to create anyhow. Like you're trying to
Hmm.
create an optimal experience for all your patients, whether they're concierge or non-concierge patients. I mean, your whole goal is to treat and create, better lives and higher quality lives for people. So I think that those are all good things. It'll be interesting to see how you go from this traditional model of probably, I'm guessing 95% plus of your work is built through a referral network or being on staff in hospitals and that type of thing. And now you're branching out into sort of patient acquisition mode, right? Where you're trying to go capture a new channel of patients in a new way. It's pretty exciting.
Mhm. Yeah, and I think what you said is really pertinent too about patient, metrics and data. I mean, what we're living in an age now where everybody loves their numbers, despite what those numbers mean, despite where they got them from. People loved numbers. People love to be able to
Yeah.
track progress or to be motivated by, some kind of setback. So that's something that I think about a lot. I've just noticed how many people are wearing some kind of metric tracking wristwatch now. I mean, probably 50% of the people that that I that I take care of, or you just socially. It's like almost everybody has some kind of like data tracking device, and we want to provide that as well, especially like with these kind of more of like the short term like package concierge models around surgery, just so patients can really see with some sort of validity, how have they improved from pre surgery to post surgery. The way we are looking at doing that right now there's extensive lab panels that are easily obtainable in the consumer market. And sometimes interpreting those is confusing, and like how much do they actually mean is debatable. But there is like the kind of lab, the data portion of it, which very much does give you a number that people like, and you can see that number kind of change, stay the same, or decrease over time. But for orthopedics, we like things such as like your functional age, which is how your body moves, like how stable are you when you move, what's your balance, like what's your leg strength like. So those are things that we want to track. And I think for our patients in the orthopedic world, that's what really resonates. If they have better balance 3 months after their surgery, that means the world. That's going to save them future injuries. That's going to give them better quality of life. And that's something that's trackable and meaningful.
And it's so beneficial too. And so there's the trackable, there's the wearables, but then you also have the connected technology too, with whether it's a Hume Health or a Whoop or all these things that are now
Mhm.
collecting. How do you get that data back into your practice? That's the other part, is that the information is being collected. I'm sure there's bone, like I think on my Hume, I actually have a bone density tracker on my Hume scale. So it's just sort of interesting how all that data can. And you said balance. As patients get older, it's after they have a surgery, and if they don't fall down again, those are catastrophic things that happen to the elderly as well. So it's pretty cool how this is all kind of coming together with you and your new practice. So when does sort of like you sort of plan a transition, or is it just sort of stay the course and go along with what you got and just sort of build these new components into the practice? How do you plan on sort of looking at that?
Our current plan is a transition.
Okay.
So we will close one night as our current brand, which is Nashville Knee and Shoulder Center, and we will reopen the next morning as our new brand.
That's great.
Yeah, and we don't want it to be that confusing. But as far as the signage on the door, I do think it's going to be that cut and dry. We open the next morning as a different brand. But prior to that, there's a whole website redevelopment that is going to have a lot of redirects and explanations, and just trying to make sure there's continuity, that people aren't confused that, wait, where did my old doctor go? We need to make that very clear. And then as far as rolling out the new offerings, that's something that we kind of hit on a little bit earlier. We need to kind of advertise to our patients that, hey, we are in fact doing this now. But then we also need to get to the community and let them know, hey, we're the same physicians providing the same great care, but we also have these new offerings. And because of like kind of the changes in medical economics, we have a new name to go along with that. So,
It's really exciting. It's always
yeah.
fun to have, take your foundation and kind of boost from that baseline and go into the future. And with, wellness, with concierge, I'm really excited to see what your practice is going to bring, Dr. Jones. And just wanted to say thank you for being here. It's been great hearing about your journey, in the knee and shoulder arena, into your practice in Nashville. And now you're into a new phase.
Yeah. Thank you for having me, Terry. This has been a
Jason, I
interesting,
appreciate it.
enlightening conversation. Yeah.
Absolutely. And by the way, for our listeners, Dr. Jones is on vacation, so he's really provided us an opportunity. He's taken his personal time to be here, so I want to personally thank you for doing that as well.
You're very welcome. I've enjoyed it.
Right. Well, thank you. Be well.
All right. Thanks, Terry.
That's a wrap on Zero Friction, the show built around one simple idea. Remove the barriers and the revenue will follow. If today's conversation was valuable, please subscribe and share it with somebody who needs to hear it. That's how we will grow this community. I'm Terry Kuchaluchis, Revenue Architect powered by AI. Come find me at my website, myrevrx.com, and let's talk about what friction is costing you and your organization. Until next time, keep removing the barriers and keep the revenue flowing.